Again, if anyone else needs permission to record, let us know and we will enable that for you. You can send us a message in the chat.
Can you hear me okay?
Yes.
Recording in progress.
Susan, is the lighting fine behind me, or you want me to? Would you like for me to try to adjust my?
You look good. We can see you. It looks good.
Okay.
I just got word that the council president will be joining us in about 1 minute.
Hi, Susan.
Morning.
Please tell us you changed your mind.
No, I haven't. So sorry. I'll miss you.
Rotten. Okay, well, we wish you all the best. We are definitely going to miss you. All right, who do we have here? I got to switch my view. Whew. Nice session this morning, Gabe. Sorry to be late, too many calls, 12:03. I'm ready if you all are.
Yes. Okay, Marsha, you can count us in.
Okay, I'll do countdown. And we are live in 5, 4, 3, 2, 1.
Good morning, everyone. Thank you all for joining us. Today, I'm pleased to be joined by Vice President Gabe Albornoz and Acting Health Officer James Bridgers, Dr. James Bridgers, and our Public Health Emergency Preparedness Manager, Sean O'Donnell. I have a few quick updates on council matters, and then I'll turn it over to the Vice President. and our other guests. First, I have a box of Kleenex here to mention that this will be our final media briefing, moderated by our great friend and colleague, Susan Kennedy. Susan has graciously served Montgomery County for 30 years and has been an outstanding liaison to the community during all her service with the council. Her reporting and her producing for County Cable Montgomery and the council have really been integral to our mission of transparency in county government. We've been really lucky to have her skills and experience for so many years. We wish her all the best in her new venture. Thank you, Susan, for everything you've done for us, and we hope you stay in very close touch with us. We're counting on that.
Thank you very much. I will definitely stay in touch, and thank you for all the wonderful years of getting to tell the great things, the stories of the great things that you do here.
All right, you got one last tight press conference to run here. All right, second, I want to address the county's mask mandate updates briefly and turn it over to our experts very soon. As you all know, last Thursday, the county's mask mandate was lifted since the county reached 7 consecutive days of moderate transmission. Under the existing, we had received official notice from Dr. Bridgers that the county had returned to substantial transmission per the CDC's data on Saturday. Under the existing mandate, indoor masking was required to go back into effect if the county reaches substantial transmission. So tomorrow we will be acting as the Board of Health to meet to introduce an amended Board of Health regulation to address the mandate. The proposed amendment will require Montgomery County to reinstate an indoor mask mandate in public areas if the county reaches 7 consecutive days of substantial transmission levels. We all want to avoid the yo-yo effect of rapidly requiring and repealing a mask mandate, which leads to a lot of public confusion. If under the amended regulation, if Montgomery County remains in substantial transmission through Friday, November 5th, Dr. Bridgers would notify the council and the county executive of this fact in writing on Friday. And if we remain in substantial transmission through then, the indoor mask mandate in public spaces would be implemented on Tuesday, November 9th at 12:01 a.m. It would not go into effect immediately on Friday in order to provide all of the public, businesses, places of worship, other establishments, the 4-day grace period that we've been granting throughout the pandemic. Let's keep in mind, of course, our neighboring jurisdictions, Prince George's County and DC, have decided to maintain their indoor mask mandates. And despite our county's very high vaccination rates, there's still a large segment of our younger population and others who are not yet vaccinated. So even as we anticipate the approval of the Pfizer vaccine for 5 to 11-year-olds, my kids asked me this morning on the way to school how soon they could get it. It will take several weeks after approval to get a majority of our around 100,000 residents in that age group alone vaccinated. And that's an important milestone. There are still very high risk and immunocompromised residents who are at even greater risk of getting seriously sick or dying from the virus, including people with premier health insurance and premier health care, as we saw with General Colin Powell, Secretary Powell. Even vaccinated individuals with the best health care can still lose their lives to COVID. So the amendments to this order are meant to take all of that into consideration. There's no clear national standard on how local jurisdictions should implement mask mandates. I've spoken to experts at MedChi and the Montgomery County Medical Society and infectious disease doctors, and they all are very complimentary of Montgomery County's approach to this pandemic and our very cautious approach to public health behavior, including the mask mandates. So through the amended order, we're trying to act in a consistent way with the approach we've taken since the very beginning of the pandemic, which we believe has saved many, many lives. These are tough decisions. There's no perfect answer. This is all risk management, but they're decisions that will have saved many, many lives and kept many people out of the hospital. And we'll be holding a public hearing again tomorrow on the amended regulation at 1:30, and we'll vote afterwards. So I know we'll have questions about that, and I'm glad to be hearing from Dr. Bridgers and our HHS chair. Third, I wanted to mention that last week I joined House Speaker Adrian Jones, along with our delegates Eric Ludke, Mark Corman, and Pam Queen in Burtonsville for a tour of the northern terminus of the new Flash bus line, which is in my district and of course opened during the pandemic. We discussed a lot of future plans for improvements and expansion of Flash buses countywide, including on Veers Mill Road and 355 and the Great Seneca corridor. We discussed connections that I've discussed personally with the department director in Howard County who would like to connect that line to Columbia and to Ellicott City. And we've discussed with the speaker transit and economic development opportunities in Burtonsville and throughout East County and what the flash bus means for driving those forward. So I wanted to express, I'm very grateful to the House Speaker and our representatives in Annapolis for all their support. The US 29 corridor has been neglected by the county and the private sector and has been left behind for many, many years, but we're making progress. You all saw a new announcement of progress by Viva White Oak, which is a transformative development proposed in East County. We are bringing a new grocery soon to White Oak, and there has been agonizingly slow but exciting progress in Burtonsville. The District 14 delegation did a great job of bringing back $8 million for a parking garage, which will allow us to redevelop the park and ride lot in Burtonsville at the northern terminus of the bus rapid transit line. And so I spoke to the speaker about how their investment of state funds, the $8 million they brought home for the garage, will help to spark new private sector investment across the street at Burtonsville Crossing from Edens, the owner of that shopping center, which has been virtually empty for about 14 years. I've had repeated discussions with Edens for months now. They've made a commitment to redevelop their shopping center because we are making commitment to invest in the public side on the park and ride side. So this will be a historic investment and spark a new sort of era in Burtonsville and an underserved community. We're very excited about that. It was great to have Speaker Jones there to see it firsthand. Fourth, last week, the Transportation Environment Committee held its first work session on Bill 1621, which modifies the county's environmental benchmarking law to include county-owned commercial and multifamily buildings to require more energy efficiency improvements and help us meet our long-term energy performance standards. The executive branch recently sent us that legislation known as BEPS, Building Energy Performance Standards. We expected it much earlier, back in 2019. I'm very supportive of BEPS. Of course, we're legislators, we have to pass a bill that works, and there's no point in passing a bill that doesn't achieve its goals. And the bill we received has a multi-million-dollar mandate on many building owners enforced by a $1,000 fine. So that won't produce the energy savings and the carbon pollution reductions that we need. So I want to make sure that committee members and the full council are well informed about the options. We are expecting to see very soon the report from Stephen Winter and Associates that was announced by DEP during the budget last spring. We still don't have that report, and that is promised to include a cost-benefit analysis and the data necessary for implementation of the legislation. So I'm very much hoping we receive that report very soon because we have constituents asking about the cost-benefit analysis of this legislation. And in spite of the uncertainties, we moved forward with our first work session last week. I thought we had a very good first conversation to make the bill work effectively. I've been working with the Green Bank to help solve a critical implementation piece, which is financing. So I've been working with them on companion legislation I'll share very soon, which will add an incentive for affected property owners who can't afford to make the energy improvements necessary and required by the proposed legislation, and will give them a way to provide that financing and reach the energy efficiency targets envisioned by the legislation. Property owners have said they want to act on climate. Many of them can't do it alone. So I'm looking forward to that legislation, which I think will help the BEPS bill move forward and be successful. Fifth, at the public safety meeting later on this afternoon, we'll be taking up police internal affairs procedures and reporting requirements, Bill 1821. That is a bill I introduced with the support of many colleagues, which includes key provisions to strengthen the transparency and the review of our body-worn camera footage for our police and help strengthen our community police relations. This has been around for months now because this was introduced, you'll remember, after Montgomery County Police made international news, unfortunately abusing two Montgomery County police officers by abusing a 5-year-old child who had wandered off the campus at East Silver Spring Elementary. The video evidence wasn't shared with us in a timely manner or the county executive, so there were no charges for those police. They're back on the street without additional training. The bill will require the department to issue body-worn cameras for all officers and share footage of all serious incidents like this one with the council and the county executive and state's attorney in a very timely manner so we can execute our oversight responsibilities and have better transparency in our body-worn camera policy. And tomorrow, finally, the council will take a final vote on Bill 4520, community policing data. We held our fourth work session last week on that bill, which improves the demographic data collection of residents during police stops and interactions with police. I want the public to see how seriously we take our community policing, both residents and our officers. I'm proud to be a lead co-sponsor with the Vice President and Chairman Katz and Councilmember Juwando. Office of Legislative Oversight did a lot of great research to provide the philosophical underpinning of the bill. And I think this is going to go a long way to enhance our community police relations. So I look forward to the council action on that bill 4520 tomorrow. And I have a couple more updates, but I'm going on for too long already. So let me turn it over to the Council Vice President.
Thank you, Mr. President, for those updates. So I'd like to begin by thanking Dr. Bridgers. This will be the first amendment that the Board of Health moves forward with Dr. Bridgers acting as our acting public health officer, and greatly appreciate the collaboration and conversations we've had over the last 72 hours to address and clean up, frankly, the policies that we had enacted in August when our numbers on vaccination rates weren't what they are now. And so, as you'll hear momentarily from Dr. Bridgers, we do believe this is the best course of action given where we are with those numbers, and to, as the council president said, minimize that boomerang effect so that we add some stability and predictability within reason to all of our respective constituents and business owners and stakeholders. I'd next like to acknowledge, last week we learned about the tragic loss of life of an 11-year-old student in Montgomery County Public Schools. A little boy named William Eliezer Cabrera Lozano lost his life. And we know that his family is, of course, beyond devastated with his loss. We know the Farmland Elementary School community is devastated. We know all of our friends and colleagues in Montgomery County Public Schools are devastated. And I had the opportunity to speak with our Director of Health and Human Services shortly after this terrible incident occurred, and appreciate and very much respect the urgency by which the Department of Health and Human Services is in collaboration with MCPS and already is under a full investigation and a top-down review to find out what occurred and next steps moving forward. But I just want to acknowledge that, and we've received numerous media calls, particularly in our Latino media, regarding this specific case. And I want everybody to be assured that addressing it is among our highest priorities. And we want to honor this little boy and his family by ensuring that this never happens again, and that we do everything that we can to provide support for that family during this unimaginably difficult time. I'd like to just end on 2 points. The council president alluded to it, but earlier this morning, we received a joint briefing between our Public Safety and Health and Human Services Committee regarding capacity of our emergency rooms here in Montgomery County. Like jurisdictions across the country, our emergency rooms were tapped prior to the pandemic, but the issues that have existed since the pandemic have greatly exacerbated some of the challenges that we've been having within our system. And now there is a code within our Department of Fire and Rescue called Code Blue, which they will issue when emergency rooms have reached bed capacity. That's not to say that emergency rooms won't continue to receive patients as they arrive and address and triage situations as they arise. But what it does mean is that for non-emergency cases, our ambulances, and we have 43, in some cases have to be diverted to other hospitals that may not be the closest to the ones that they need in order to be able to seek care for their patients. And what we also know is that while they are in Code Blue, they oftentimes have to wait in parking lots until an emergency room bed is freed up so that the patient can be seen. And this, of course, puts a strain on the system. As we learned this morning, there's a complex set of reasons for those issues, but the top 3 are we are suffering staffing challenges and shortages in pretty much all categories of both first responder positions, but also within our emergency rooms themselves, which is an issue across the country. Second is we also learned that there's a significant rise in the number of behavioral health cases that are taking up bed capacity as well. And for some of our adolescent patients, they're no longer measuring some of the stays in hours and days, but in weeks and months, because there is not a sufficient bed capacity on the back end for them to be able to make referrals. And we also know that there is, coming out of the pandemic, a larger volume of more complex cases, in part because people weren't going to the emergency room or seeking preventative care through the pandemic. And so this is yet another example of a byproduct of the challenges related to the pandemic. And in the committee sessions today, we discussed potential solutions, both in the short, medium, and long term. And we will be having a follow-up session before our December recess to talk about some of the state policies that will need to be addressed in order for us to be able to more holistically address the issues before us right now. I'll also end with this Thursday. We have a joint education and culture and HHS committee session to talk about our staffing capacity within our school health nurse program, which we know has been strained and was challenged prior to the pandemic, but now coming in and adding the other layers of responsibilities with regards to testing. We're working diligently on those issues to find solutions, but it's an opportunity for us to have further dialogue and discussion on this very important issue that we know we've been receiving a lot of correspondence about. So with that, I'll yield back to you, Mr. President, and would be happy to answer questions after Dr. Bridger's presentation.
Great update. I'm glad you're having the second joint committee to talk about the state role, which is critical. Dr. Bridgers.
Good afternoon, all, and thank you, Council President Hucker and Council Vice President Albornoz for inviting me today. Mr. O'Donnell will do the daily crosswalk and run of the numbers in our pulse report and what we have been seeing as our case counts, which, by the way, are going down. But also those strategic measures that we are enthusiastically waiting to deploy, hopefully this weekend, with our 5 to 11-year-old vaccination plan. So as Council President Hucker indicated, we've had multiple conversations with Council, with our experts in the field, Medical Society, our Public Health Advisory Committee, and I had a conversation over this weekend. I remind folks that that is a cadre of medical research and epidemiology professionals in the field who we convened to help us work through and look at the data and the science and the best practice for the guidance that we provide to the Council sitting as the Board of Health. We've had 5 waves over the past 20 months. We know that, if my memory serves me right, the first 3 cases in Maryland were in Montgomery County due to travel. And so in looking at many of those variables outside of our case counts, our hospitalization rates, as Council Vice President Albornoz indicated regarding bed access in those ICU and acute care beds. We also look at the reproduction rate, the R0 value, that has gone up and down and has continuously been above 1, which demonstrates that there is a higher level of community level transmission. And of course, we look at the test positivity rates. Now, all of these metrics we take in consideration, and we vetted those rates again with our Public Health Advisory Committee and other experts in the field. I think that the Board of Health regulation, as it will be presented tomorrow and amended, will demonstrate those strategic and best practices that we currently can deploy in our settings, as far as the time period to review before and after there's a change in threshold from substantial or to moderate. We've been as high as a high category, and at the beginning it was low, but it iteratively climbed and decreased. We know that there are 9 strains of the coronavirus out there, with Delta still being the predominant strain, and the lineages. And so we need to take those considerations, those factors in considerations. As both the Council President and Vice President indicated, we still have 95 to 105,000 unaudited children who still need to be vaccinated, and we are working very hard to get that portion of the population vaccinated. All of these strategies take in consideration. There is no clear cookie cutter guidance. There's no playbook. We know that CDC has revised and updated its guidance multiple times over the past 20 months. But at the end of the day, we want to keep folks safe. We know that it's also cold outside, and we encourage folks to get their flu shots. Last year, we didn't see the level of flu cases because many folks wore masks. We know that masks are proven and effective preventative measures to mitigate the transmission of the COVID virus. And so we have taken all of these variables into consideration, and we've made recommendations to council sitting as the Board of Health, and we look forward to that discussion again. But we've done all these things to keep the county safe. We have great numbers as far as our vaccination rate, and that is proven. And we want to get through the next round of vaccinations, which will clearly impact our case count. Speaking of case counts, we've had a couple of days last week, which caused the threshold to go above 50 cases. We had a day of 100 cases, 94, and I think 108. And so today our case count is 53. So again, the fluctuation of this, of the community level spread. And lastly, I'd like to say that the coronavirus is such an enigma that we try to plan and make those projections, but at an even given point, it may change. And I just want to remind folks of that. Thank you, Council President and Vice President, for a minute just to share some of the background and discussions that we've had over the past 3 days. And I will turn it back to you, Council President Hooker.
Thank you so much, Dr. Bridgers. Mr. O'Donnell, do you have anything to add, or?
Just happy to answer any questions you all may have about the vaccination rollout. We did follow along that FDA has approved the emergency use authorization for 5 to 11-year-olds. So at this point, we are waiting for the CDC to convene their panel and review those recommendations, and then hopefully make an authorization either tomorrow or Wednesday to use the vaccine for 5 to 11-year-olds. And at which point we understand that Maryland Department of Health will also update their statewide guidance and authorizations, and we're prepared to start providing vaccine as soon as that happens. We will have a set number of appointments each day that are for pediatric vaccinations, and during the weekdays, we're allocating those to the early evening so that they don't overlap with times when people would be in school. And then on our plans on the weekends right now are coordination through Montgomery County Public School System and a number of sites that they have helped to identify in some of our hardest hit neighborhoods. So we'll be doing that on Saturday and Sunday, again, if this is approved by that point.
Terrific. Thank you, Mr. O'Donnell. Ms. Kennedy, I think that's everyone, so we can move on to questions.
Okay, great. Our first question today comes from Stephanie Ramirez from Fox 5, excuse me. She has questions for Dr. Bridgers and the council president.
Used to be WUSA. Thank you, Susan. And I didn't know you're leaving. I'm sorry to hear that. Thank you for your time here.
Thank you.
All right. So a couple questions just to follow up on the issue with the health order language. We know there's two issues there. One having to do with preventing the yo-yo effect, and the other one not really clarifying which metric it is that would base these changes off of, whether the percentage or the 7 cases 7 day per 100,000 people. My question to you, President Hooker, is, could the county council have addressed this anytime last week, acting as the Board of Health? And if it did not, if it could have and didn't, why was that the case? And what's your response to those who are criticizing, the county for having these issues over the weekend pop up over whether or not to implement this mask mandate?
I think, the data and our track record on our approach to the pandemic validate the approach that we've taken, in that we are one of the healthiest counties in the nation with the highest vaccination rate. We have worked very hard to address our racial equity gaps over time, and we are a standout among counties, among the 3,000 some counties in the nation, as having some of the best performance during COVID. This is the most recent of our Board of Health regulations. We put, several of them in place, as you know, and I think we are digesting the new information that came in, and we're updating the Board of Health regulation as we've continued to. So I think people are safer because of the approach we've taken. We continue to follow the advice of our public health officials. And, I get plenty of mail on both sides, as you might imagine, Stephanie. Overwhelming majority of people are grateful for the approach that we've taken because this is Montgomery County. We're the home to the NIH and Dr. Fauci, and most people believe in following the guidance of our public health officials. I don't know if Vice President or Dr. Bridgers have anything to add, but that's just my take on it. There's been no sort of objective, manual for us to follow through this. That we've been doing the best we can, following the medical advice on a virus that didn't exist even, a few years ago. So that's where we are, why we are where we are now.
So the notification this weekend was the first time that the county council was made aware of this issue with the health order?
I think Friday, before this weekend, yeah.
Friday, that's correct. That's correct. So, Council President Hucker, I'll weigh in if I may. So, when Dr. Gales initially advised Council of the sitting as a Board of Health of the increasing and the alarming rate that the Delta variant was being transmitted, not only across the nation, but then it hit Maryland and Montgomery County. We know that that variant transmits 5 times greater than the original alpha strain. Moreover, during the time that the Board of Health submitted the regulation, we had Mu come on the scene. We had Mu, Gamma, Lambda, and Iota. So 3 additional strands came aboard. And of those, Council President Hucker indicated that, Mu really impacts those individuals. So Delta transmits 5 times greater, but Mu is a greater threat to those individuals who are vaccinated and who have some sense of immunity. I don't know if that's the case in others, but I know that that is a fact based on the data that we've reviewed. And so in looking at the measures, the pre and post measures, the initial Board of Health regulation identified for 7 consecutive surveillance days. The recommendation based on feedback and input from the medical society and researchers indicated that we should also identify and amend that Board of Health regulation to have a off-ramp, if you will, 7 additional days to surveil to see if there's any upticks or trend in the number of cases. This is the amendment to have 7 days of surveillance pre and post any transition from any threshold. We're right on the cusp of that threshold now between moderate and substantial transmission. So in an effort to create a proverbial yo-yo effect, if you will, the board received additional public health input to look at the best way forward to alleviate any changes. We understand that the virus doesn't really care about any of the practices that we deploy, but we want to look at the community as a whole. We know that folks have been traveling. We know that over the past couple of months, folks have been traveling in and out of the state as well as the country. And so these protective measures are being considered by the Board of Health to mitigate or prevent any further spread.
Now, and a follow-up, Dr. Bridgers, while I have you now, you were in the virtual press conference earlier with MCPS.
Yes.
One of the parents who's criticizing, who's very, very upset with and frustrated with what's been going on, did also point out that for the students who have contracted COVID, that they are recommended not test for 90 days. How will they be, how will they be weighed, with one of the measures being that if you test regularly, that you don't have to quarantine if you have an exposure with a mask on?
So it's self-attestation. They can provide documentation based on their transmission, or if they were directly, or if I understand your question, contracted COVID-19 in the past 90 days. And so we continuously work through that, but they have some form of antibodies based on the natural infection as other individuals who have. We recommend, as we've always done, to have them not only consult their primary care provider, but if they have contracted coronavirus, please provide the information to our MCPS partners so they can identify those individuals.
Will they be excluded though? So their doctors have to reach out to MCPS?
Right, and just provide notification so they won't have to, they are considered individuals who will not have to be quarantined due to a close contact.
I do have some other questions, but I know there's other folks on the plate. So if I can, after asking another question, thank you.
Sure, no problem. Thank you, Stephanie. Next, we have Dominique Maria Basseni from WAMU. Good morning, Dominique.
Good morning. Thank you so much. Councilmember Hucker, I just had a quick question. So when I spoke to you on Friday, you said there was the possibility of doing one or another thing with the transmission rate. One of the things you told me on Friday was, oh, we could have 17 days of moderate transmission to be sure that, in order to lift the mask mandate, with one of the options. I guess either Council President Hucker or Dr. Bridgers, why choose the latter where it says, well, if we have, 7 days of sustained transmission, then, or sorry, substantial transmission, then we're gonna, keep the mask mandate off. So I'm just trying to understand, why do it this way rather than another way?
Sure, Dominique, just following up on our conversation on Friday, I don't think I said 17, but I think it's just sort of.
I'm sorry, 14 days. I don't know where I got 17 from, 14 days.
And that's fine. I think it's not, I think I was expressing the options available to us. We could either have a more conservative, more restrictive policy or less, right? I don't think there's any perfect answer. And I've talked to people at NIH, talked to people at the Medical Society, talked to people at MedChi, talked to people at the Maryland Department of Health. They could confirm there is no perfect answer. This is sort of judgment from a public health point of view. And I think we all want to keep our public safe, number one. We want to avoid the yo-yo effect and give people predictability and transparency, number two. And we want to do that by following the guidance of our public health officers, number three. And that has been our approach generally through this whole pandemic. And that, I think, has kept people out of the hospital and kept a lot of people alive. So I haven't changed my point of view on that approach. I think it has paid off and the data would support our approach. And so I don't want to get in front of the council's discussion tomorrow, the Board of Health's discussion. We will have potential amendments to the proposed regulation, and my colleagues are free to suggest anything they want and make any points, and I don't want to characterize their point of view, but I think I was trying to say Friday, we could take a more or a less conservative approach. I think we're in line with now keeping a mask mandate in place, DC and Prince George's, which I think are healthier than most of the other counties in the state and the country. So I think that approach has made sense. And, I think we'll all find out where the Board of Health lands at the end of the discussion tomorrow.
And sure, just to add, Council President Hucker and Dominique. So as Council President Hucker said, we looked at multiple scenarios based on our conversations with our experts as well. And so looking at 7, 10, 14, and even out to 20 days, what was more predictable, as Council President Hucker just indicated, and a 7-day measure is more predictable because we can make the necessary adjustments accordingly over a 7-day period, both pre and post notification. It would also give us greater predictability to identify any trends that may be existing or that may existed, or not only those case counts, the positivity rates, but where are we trending over a week period for those hospitalization use? Is there any deaths, et cetera, based on the cumulative cases or the cases that we have on a daily basis? So that's part of that rationale that went into the recommendations to council sitting as a Board of Health.
And then just finally, this question is for Dr. Bridgers or Mr. O'Donnell. I'm just looking at, wondering if we had any times for those school and vaccination clinics for 5 to 11-year-olds. I know those times are being finalized like early this week, last week. So when will you be publishing those on your website? We'd like to be able to link to it for our purposes.
Yes, so we will likely publish those once once we have the authorization confirmed that we can go ahead and do the clinics. I'm trying to avoid a situation where people start to register and then we have to delay the opening of a clinic because the authorization has not come yet. But it'll be shortly after we get that authorization. We're also working to ensure that we have an equitable distribution of appointments across the county and across our populations. And so we are working with the school systems and other partners in the community to, again, make sure that appointments are not just first come, first serve. So we'll be working in tandem with that, but it'll all be the appointments that are published to our website will be through the same location as they currently are. So that would be the best place to link to.
And sorry, just to follow up. So you will be not making appointments. People can't make appointments until you guys have the vaccines in hand.
Well, it'll be once we have the authorization to start conducting clinics, and then we'll go public with the appointment system shortly after that. We do expect to have vaccine in hand within the next few days.
Thank you.
Thank you, Dominique. Our next question is from Shayna Estulin from WTOP. She has questions for Dr. Bridgers and the council president.
Hi, thanks for doing this. So I know you sort of answered this already, but just to go back, so when this regulation was originally put in place, I believe in August, if that's correct, were there discussions back then that this would create a yo-yo effect, having this one-day snapback, or did the discussions only happen this weekend? And then if you can answer them, then I have a follow-up question after that.
That's a good question. I'd have to go check the tape to remember. I don't often remember what I had for breakfast, much less what we discussed in August. But I think consistently we have wanted to keep people safe and give people some predictability and transparency. Our business owners, parents, where we are regulating the school system, et cetera. So again, there's no manual where we can take a model piece of legislation from on this. There is in many, many, many other topics that we deal with, but not on how you deal with a virus that didn't exist a few years ago. I think asking people to wear a mask compared to raising their taxes or many other things is a very small inconvenience to ask people to sort of put up with, for lack of a better term, if it might save a life. That's something. My discussion with the Maryland Department of Health yesterday, that they sort of said that in a lot of public health, correct me if I'm wrong, Dr. Bridgers, a lot of public health decisions, you're making judgment calls based on an assessment of risk. Milestones are important, right? When we debated this over the summer, we didn't have a crystal ball into the future. We had hoped there would be a vaccine for kids, for example, in the future, but we didn't have one. Now we have one, and it's imminent. And as you heard Mr. O'Donnell say, we're expected to have it in hand in the county within days. So knowing what we know now, not what we knew last summer, does it make sense to do everything possible to keep people safe now and keep our schools open, as we agreed was the goal, prevent an outbreak in the schools and a great inconvenience on our parents and especially our kids that are dealing with the COVID slide already from the last year and a half? All of that makes sense. It's certainly, I bet I'm not the only council member that wants to get through the next few weeks and keep our case numbers down and get our seniors and others their booster shots and get our kids their vaccines, and then see where we are a few weeks, a month from now.
You didn't see it as an error that you didn't have that you had that kind of language. You see it more as just we're learning as we're going.
I don't remember whether we discussed it or not. I think you make the best decision you can with the information you have at the time, and now we have new information. Hindsight always 2020. But
yeah, well, just for more context, as folks will recall, we established the benchmark to add a degree of predictability because we had been meeting as the Board of Health almost every week with adjustments coming up and down. And so what we attempted to do with this legislation was give businesses and stakeholders just that air of predictability and connect it to a specific number, which they had been requesting understandably. And we agreed that they had, so that there could be plans made. And we did add a provision that there would be a 4-day threshold before it would actually be enacted to give businesses a runway to be able to implement. But, it is undeniably true that the day after we had enacted this and it triggered the number, immediately when we got the email from Dr. Bridgers that this was going to be an issue, all of us got on the phone and a series of meetings were established. And as has been the case throughout the pandemic, we've adjusted as necessary and as quickly as possible to make changes. And that's why we scheduled this Tuesday the Board of Health session, which wasn't originally on the council's agenda. We've put it in so that we can address this issue. I acknowledge and respect the frustration that have been expressed by a number of people. We have certainly seen the social media posts. I would just ask that everyone continue to have some degree of patience as we work our way through. And the great news is the headline should be that because the vaccination rates are as high as they are, we were able to trigger this alleviate the mask mandate in the first place. And let's keep our fingers crossed that after we enact this amendment on Tuesday, that the 7 days hold and that we don't have to go back. But this will give us a chance for us to be able to observe in a reasonable fashion.
Just one follow up on the 7 day timeline. So how will that work? Because you've had a couple days after where the transmission rate was high. I think today it's lower. Will the clock start again on Tuesday if the amendment passes? Like, when are you going to start the 7 day countdown?
So the clock starts retroactively for the 7 days from when Dr. Bridgers acknowledged that we had hit that we had hit the initial threshold. Is that correct, Dr. Bridgers?
That is correct. And Council Vice President, if I may, let me just jump in and just add a couple of key points that I think Shayna and the other media should capture. When I went back to review the case studies, if you will, of the Board of Health regulation and all the discussions and the backgrounds that were associated with it from a research standpoint, so that I could have some bullet points to talk to our advisors, our medical and scientific advisors. We didn't have the other variants out there. We didn't have mu, lambda, iota. We principally, based on the Board of Health regulation, as it stated back in August, was drafted to combat, decrease, mitigate the spread of the Delta variant. And so all of those, the predictability of that was not in place. The other piece is Montgomery counties have countyans have gone out, they've received the boosters. We didn't know that when the boosters were going to come online. We didn't know when those third shots were going to come online for our immunocompromised to not only combat the variants, but increase the immunity of our citizens. And so when I looked at and tried to re-examine the Board of Health regulation, there was a point of notification that the health officer and or his or her designee was obligated to notify the council when we went from one category, one threshold to another. I think we've had conversations with experts in the field to address those patterns, to look at where we realistically can assess the transmission levels before and after that threshold. And I think this is where we are in the current proposed amendment to the Board of Health regulation.
Thank you, Shayna. Next, we have Lucia Jimenez on behalf of Andrea Serralde from MCM. She has a couple of questions for the Council Vice President. Lucia?
Hi, thank you so much, Susan. Good morning, Council Vice President. Yes, I have two questions on behalf of Andrea. If you can please answer them in Spanish, would really appreciate it. Thank you. Para la primera pregunta, por favor, ¿podría hablar un poco sobre el mandato enmendado del uso de las mascarillas en espacios interiores primero?
Gracias, Lucia. Mañana el Consejo, sentado como la Junta de Salud para el Condado, va a promover un nuevo orden que va a confirmar que en este momento son 7 días enseguido de 50 casos o menos o más que se inicia o se termina la esperada de tener las mascarillas, pero vamos a establecer un nuevo policía mañana que dice que son 7 días en el otro lado. Así que va a ser 7 días enseguido con más de 50 casos por cada 100,000 residentes en el condado, donde se tiene que restablecer el orden de mascarillas. Y aprendimos este domingo que llegamos al nivel en la legislación antes de que era parte de este orden. Así que ahora vamos a limpiar eso un poco para que sea lo mismo en los dos lados del orden de las mascarillas. 7 días.
Muy bien, muchas gracias. Y como la segunda pregunta, ¿cuándo se espera iniciar la vacunación para menores de 5 a 11 años en el condado?
Voy a preguntar en inglés para confirmar esa pregunta y después lo voy a responder en español. Dr. Bridgers, the question was, when can we anticipate the vaccination being available for children between 5 and 11? And I'll translate in Spanish for you.
Sure, great question. We hope to receive vaccines this week, and as soon as we receive the 5 to 11-year-old pediatric vaccine, we will begin after we receive clinical guidelines from the Maryland Department of Health, hopefully this week, hopefully as early as this weekend, if not sooner.
Esperamos recibir las vacunas para jóvenes de 5 a 11 años esta semana y esperamos que podemos empezar a iniciar a dar las vacunas lo más pronto que este fin de semana.
Muchas gracias.
Thank you, Lucia. Next, we have Lilian Mass from Telemundo with a question for the Council Vice President. Lilian?
Good afternoon. Could I say that? Is that afternoon? Susan, correct me, please.
It is. It's afternoon.
Okay, so everyone, and I would like to ask a question in reference of the William Cabrera case. Concejal Albornoz, one of the things that the mother said last week was that she wasn't able to take her son to the doctor because she was waiting for the renovation of her Care for Kids card. So my question to you is there any provisions or protections in Montgomery County that guarantee medical access to those who are awaiting for the renovation of their coverage? And if you can answer in Spanish, please.
Sure. Bueno, primero, Lilian, gracias por esa pregunta. Mi corazón está quebrado por la señora Santos y su familia. Y estamos trabajando con el Departamento de Salud y Servicios Humanos para revisar todas las reglas sobre Care for Kids para estar seguro que puede cubrir a familias, no importa dónde están en ese proceso. Así que voy a tener que llamarte de nuevo con esa información específica, pero sí que es sumamente importante que las reglas están ahí para que sea lo más fácil posible para que familias puedan obtener esta seguridad que es sumamente importante para ellos.
Ahora, en términos de lo de las máscaras, si nos puede, no me quedó un poco claro, entonces lo que me está diciendo es que han estado esperando por 7 días a que hayan menos de 51 casos reportados diarios.
Exacto, en 7 días enseguida.
Y esto no ha pasado.
No ha pasado todavía.
¿Qué se espera que se discuta el día de mañana en la sesión legislativa y cuál, basado en los resultados que tienen hasta ese momento, y cuál piensa usted que va a ser la decisión que van a tomar el día de mañana?
Bueno, mañana vamos a confirmar que el reviso va a ser 7 días, no solo un día, que es el caso en este momento. Y esperamos, porque hemos visto las últimas 2 semanas que los números están subiendo y bajando mucho. Y esperamos que ojalá después de esos 7 días vamos a tener la información que indica que no tenemos que empezar o iniciar la policía de tener mascarillas por todo el condado, pero vamos a ver, después de esos 7 días, los 7 días empezaron ayer. Así que a los fines del próximo domingo vamos a saber si lo tenemos que hacer de nuevo o no. Pero es mucho mejor de solo tener un día de información como era el caso antes.
Perfecto, muchas gracias.
Thank you, Lillian. Next, we have Marcela Rodriguez from Univision, who has a question for the Council Vice President. Marcela?
Good morning, good afternoon. Thank you so much for having me. I would like to follow up on what Lilian Mass just asked in regards to the incident that happened at the middle school recently with the death of a student. If you could please give a message to our Latino community. This case is very tragic, and many parents have many questions on what happened. So I would like to know a little bit in Spanish how the investigation is going and what's the plan that Montgomery County Council has to prevent this type of incidents in the schools.
Marcela, gracias por esa pregunta. Como indiqué antes, mi corazón está quebrado. Yo tengo un hijo de 11 años, así que ni me imagino perder a él o cualquier joven o niño que tenemos aquí dentro de nuestra comunidad. Y le mando bendiciones y cariño a la familia, y les quiero asegurar que estamos trabajando con los oficiales del Departamento de Salud y Servicios Humanos, el sistema escolar del condado, para hacer una investigación para ver qué es lo que pasó en este caso, y como el consejo nosotros tenemos la responsabilidad de estar seguros que los oficiales están haciendo su trabajo. Y vamos a estar seguros que lo están haciendo. En este momento tengo confianza en el sistema y en la investigación que se inició inmediatamente después de la pérdida de vida de este niñito. Y esperamos a tener más información a los fines de esta semana de cómo va esa investigación, y si lo tenemos que hacer. Tal vez podríamos establecer una fecha para que los comités del condado revisen estos casos también, pero en este momento los oficiales de esos departamentos están encargados de manejar la investigación a este punto.
Muchísimas gracias.
Thank you, Marcela. Next, we have Paul Wagner from WNBC for the question for the Council President.
WNBC?
WRC, right? Sorry about that.
No worries. Question for Tom, please. Hi, Tom. So for us who parachute in and out in TV world here and don't follow this on a regular basis, can you please clear up some confusion? And it would be helpful to have what's really going on here in a soundbite if you could. And that is this. So the mask mandate was lifted. Yet we've seen an increase in transmission. Dr. Bridgers said 100, 94, 108, then back down to 53. Can you tell us right now what's going on? That there's a meeting tomorrow with the council, a vote. I've also heard that perhaps Mr. Elrich wants to change it from 7 days to 14 days. I don't know if that's correct or not. Can you tell me exactly what's happening with this vote, and what is the reality of the mask mandate?
Sure. The council sits as our Board of Health. We have the authority to put these kind of restrictions in place that have kept the public generally safer than most places throughout the pandemic. We put this current order in place last summer, and we will be taking up potential amendments to it based on the advice of our Board of Health, based on the advice of our health officer, including Dr. Bridgers here, tomorrow.
So you're
my colleagues are all members of the Board of Health. They can propose anything, but the current proposed amendment would require 7 days in a row in what the CDC defines as substantial transmission levels in order to restore the Board of Health, the mask mandate.
Okay, so since it's back down to 53 today, that means the mask mandate would remain off?
Well, it's in place, Dr. Bridgers?
Sure. So Paul, what that would mean is when I gave notification over the weekend that we were in a substantial category based on the CDC numbers, The council met to determine a 7-day measure. The original day measure notification was 1 day after the case rate either moved from moderate to substantial. What the council has amended now is that if the case rate continues to trend in the current pattern, which we saw that led up to this particular Board of Health regulation, the mask mandate reinstatement would stay in place. Again, we're looking at the case counts. We've had a day of 108, 95, 108. On the 31st, it was 59. Then it went down to 53, and now it's at 43. If we continue to hold on a pattern, we will move again from a substantial transmission category to a moderate category, which would stop the mask mandate. Council has set forth regulation that would allow for a pre-assessment, which would determine that there's a trend and that we have moved into this category consecutively. And on the back end, that we're moving back into a category consecutively. It wouldn't be an abrupt halt where the mask mandate would be reinstated.
All right, then one other quick question, either for Tom or you, Dr. Bridgers. What do you take of the fact that when you lifted the mask mandate, I live in the county, and going around the county, people were still wearing masks indoors. Costco, and when I went into Whole Foods and Safeway, everybody's still wearing masks. What do you take from that?
So we've been wearing masks for over 20 months, and it has become a practice. We know that masks are effective in preventing the spread or further spread of the coronavirus, especially in indoor spaces and where we interact and have community access to those individuals outside our household. The last piece is, as both the council president and vice president have articulated, is that we have a significant portion, 105,000 children 5 to 11-year-olds who are unvaccinated. And I think many individuals have heard us repeatedly indicate that we model that behavior. We wear the mask to not only protect those individuals, but for those individuals who are age 2 and older who wear masks. And so I think folks are just accustomed to wearing masks, especially in some jurisdictions where they know that they have even lower case counts. Now, if you travel outside of the area and you go to western parts, the case counts are 3 or 4 times the case count here. And I think those preventative measures, based on what we've seen in our research and we see in the data, continues to be that masks are an effective measure, especially when you have those who are unvaccinated individuals.
Thank you.
You're welcome.
Thank you, Paul. Our next question is from Dan Shear from Bethesda Beat. Good afternoon.
Hi. This question either for Tom or for Dr. Bridgers. I was a little confused about the 7-day clock. Dr. Bridgers, I know you said that we entered substantial transmission starting Friday, but can you just kind of explain why this would take effect on the 9th and not the 4th or the 5th?
Sure, absolutely. So Daniel, so we look at data. Our team, our statisticians and our epidemiologists here in the county and within HHS look at the data daily that we receive from the Maryland Department of Health. We know that historically the data reporting at the state level lags at the federal level. So we may report a substantial or moderate transmission rate a day earlier than what the state reports, but we have historically and traditionally used the CDC data as a measure because they have multiple data feeds that would correlate to what we're doing. So as Council Vice President Albernos indicated, the Board of Health regulation is set when they receive official notification, which was Saturday. That's when CDC reported on their dashboard and website that we had moved into the substantial category. So for 7 days, from the Saturday until Friday, is the period that we're monitoring now, as I indicated, whether or not that holds or we will move back from substantial to moderate. We're very close, and based on the case count, we continue to do our own internal analysis to see if there's any trend, if we're trending up or we're trending downward. The last piece of that is set forth by the proposed Board of Health amendment is that on Friday, if we are still in that category, I will send official notification to council sitting as a Board of Health that after 7 days, we are still in the category. We have traditionally given businesses time to reinstate the mask mandate, which typically has been about 4 days, which was land us on the 9th, I believe, if my math serves me right.
Thank you. Just to follow up, I know that you all are trying to avoid this yo-yo effect of, kind of going back and forth. I guess, can you sort of explain the rationale behind 7 days, why choosing 7 days? I mean, does that give you sort of a greater degree of confidence that, you won't have this situation where you're going back and forth, or just maybe expand on that?
Sure, absolutely, Daniel. So based on our epidemiology profile, we're looking at a 95% confidence interval based on the data analysis that our team did here. So 7 days would be the best indicator or measure to determine whether or not we have an uptick or if we're trending up or down. 14 days, if we use 14 days on the back end and 7 days on the front end, so we monitor for 7 days, we move into a moderate category, and we can determine, hey, we are in fact in a moderate category. And if we look at 14 on the back end, well, if we use 7 days, what happens at day 8, 9, and 10? And we know that there are outbreaks, that we have an increase in surge in the hospital. It doesn't afford us the flexibility to enact additional measures to prevent any further transmission or outbreaks. So 7 days based on our research and analysis and expert opinion provides us the best measured approach, both pre and post notification.
Thank you.
Thank you, Dan. Well, that wraps up the questions today. So we want to thank all the members of the media who joined us today, all our officials, and everybody. Continue to have a marvelous Monday. See you later.
Thank you. And congratulations again, Susan.
Thank
you so much. And thank you, Susan.
Thank you. Take care.
Bye.